If we take a look at this question, again, this looks to be a little small question. What should this patient be treated with? That means we need to read this question. Let us take a look at the options: antibiotics, anticoagulants, FFP and platelets, IV saline. Okay, so now let's take a look at what should be the question. 34-year-old, okay, so that is, he's an adult, building construction worker, fell off a ladder, sustaining bilateral femoral fracture. Okay, so this is a case of femur fracture. His massive bleeding resulted in DIC. Now, basically, he is in DIC. That means there is a consumption coagulopathy. That means because of the femur fracture, what would have happened in this patient? There would be huge amount of bleeding. So there is a blood loss. That means there is loss of platelets, loss of clotting factors, right? In this patient, he has lost a significant amount of platelets. He would be bleeding. So what would be the best? What should this patient be treated with? Now, antibiotics, we all know there is no role of antibiotics here. Anticoagulants, already the patient is bleeding. Why we would like to give the anticoagulants? We will like to give the procoagulants so that we want that the bleeding should be controlled. Fresh frozen plasma and platelet. Yes, patient is suffering a huge loss of clotting factors and platelets, and we know this is rich in clotting factors and these are platelets. So this would be the most appropriate. Let us take a look at this IV saline. Yes, some of you have marked this as IV saline as well. Now, if it is IV saline, just imagine that he is talking about DIC. Already the patient is having less clotting factors and platelets in his blood. If you give more amount of IV fluids, agreed that IV fluid is the initial form of resuscitation. But specifically, if you are talking about DIC, then if you give more amount of IV fluids, it is going to cause further dilution of the clotting factors. Suppose a patient was having X amount of platelets in his circulation or X amount of clotting factors in his circulation before the accident. In the accident, he has lost 50%. That means already the level of platelets and clotting factors have reduced to half. And now when you are pumping in IV fluids, it is going to cause dilution of those platelets and clotting factors. So this is further going to lead to hypo levels of these clotting factors and the platelets. That means thrombocytopenia and all. Bleeding will not get controlled by just giving the IV fluids. So for DIC, the best thing what we can do is we should give FFP and platelets. That is why from my side, the correct answer for this question would be the fresh frozen plasma and the platelets.